My name is Shannon Wood. I'm Director of Disability Policy at the Muscular Dystrophy Association. And today I'll be speaking about policies to support family caregivers. So first, a little bit about MDA. MDA serves people living with muscular dystrophy, ALS, and related neuromuscular diseases, including SMA. For over 75 years, MDA has led the way in accelerating research, advancing care, and advocating for families. For those who are not familiar with neuromuscular disease, although I know you just heard quite a bit from Maynard, they are rare and genetic. Most are caused by changes in at least one gene, and they can present at birth or later in life in adulthood, and generally they cause muscle weakness, fatigue, and are progressive, meaning that they get worse over time. And MDA's mission is to empower the people we serve to live longer, more independent lives. So looking at caregiving in the neuromuscular community, we know that research breakthroughs are leading to longer lives for so many conditions under MDA's umbrella, but due to their progressive nature, many will require support at some point in their journey. And as Maynard said, family caregivers really serve as the backbone of the neuromuscular care system. They fill gaps left by insurance and really complete these essential specialized care tasks, whether it's helping with complex medical arrangements, assisting with mobility, providing emotional support, financial help, and more. The bottom line is that family caregivers improve quality of life and prevent unnecessary, costly, harmful institutionalization, keeping people in their communities where they overwhelmingly prefer to be. And while it can be deeply rewarding, speaking from personal experience, caregiving can also present significant challenges. And a top challenge that is shared with MDA's Resource Center is difficulty navigating the government agencies to get the benefits that their loved ones need, whether it's health insurance like Medicaid or Medicare, or Social Security benefits like SSI or SSDI. They're constantly telling MDA about how they experience what we refer to as administrative burdens. So frustrating, invasive, repetitive paperwork, waiting for hours to speak to someone, really complicated applications and websites, and all of these really serve as barriers to care and coverage. Thankfully, there are leaders in Congress who have introduced legislation to reduce administrative burdens, and that's through the Alleviating Barriers for Caregivers Act, or the ABC Act. The Senate bill number is 1227, the House bill number is 2491, and again, this is bipartisan and bicameral, and let's take a look at what the bill does. So this bill requires CMS, the Centers for Medicaid and Medicare Services, and SSA, the Social Security Administration, to review their eligibility processes, procedures, forms, and communications to reduce burdens on family caregivers and individuals navigating benefits. There are some specific goals that are outlined in the legislation for the review. The first being to streamline policies and simplify procedures to determine your eligibility, enroll and maintain coverage, and utilize the full benefits that are available to you. The second goal of the review is to reduce the frequency of providing the same information more than once, whether it's completing multiple documents for each agency or providing information they could easily get from another agency. So think about things like medical records and work history. Another goal of the review is to make it easier for family caregivers to work with agencies through very specific measures outlined in the bill, like decreasing call wait times, providing timely answers, improving the accessibility of their websites, improving access to in-person appointments, and also just generally improving relationships, like through regular meetings. The really important thing that we love about this bill is that in conducting the review, officials must seek input from family caregivers, including caregivers with disabilities, as well as individuals who are filing for or receiving benefits on their own. A report to Congress is due no later than 2 years after the review. That's to be publicly posted on agency websites, and that will outline the issues that they identified, actions being taken, and recommendations for changes to the law. So the congressional ask before you on the ABC Ask is to co-sponsor the bipartisan ABC Act. It has been, again, introduced in the House and Senate. On the House side, it's been jointly referred to Ways and Means and Energy and Commerce Committees. On the Senate side, it's been referred to Senate Finance. And then another top challenge that we hear over and over again from family caregivers in the neuromuscular disease community is difficulty covering the high costs of caregiving. Neuromuscular care is very expensive, it's very complex, and it requires lifelong management. Some of the top costs for the neuromuscular disease community can include medications and specialist visits, assistive devices and technology, home and vehicle modifications to make their home and vehicles more accessible, and of course, paid care. And the neuromuscular disease community is really not an outlier here. The most recent data from AARP estimates that family caregivers are providing about $600 billion annually in unpaid labor, that they're spending 26% of their income on caregiving expenses out of pocket. That's about $7,200 a year. And really concerning is that nearly half, 47% of family caregivers report at least one negative financial impact as a result of providing care, whether that's stopping putting money towards their savings, taking on debt, or leaving bills unpaid, or putting bills on credit cards. But again, we have leaders in Congress who have introduced legislation to offset certain costs of caregiving, and that's through the Bipartisan Credit for Caring Act. The Senate bill number is 925. The House bill number is 2036. And this bill is very straightforward. It would create a 30% tax credit on qualified expenses after an initial $2,000 in qualified expenses is spent, up to a maximum credit of $5,000. It does phase out at higher incomes and coordinates with existing provisions to prevent double dipping. And the great thing about this bill is that a lot of the qualifying expenses included in the legislation include really core components of neuromuscular disease care. So home health aides, home modifications, transportation, assistive technology, adult day services, respite, so that the caregivers can receive a break from their responsibilities. The caregiver must have more than $7,500 in earned income a year, so this is really a policy solution geared at working family caregivers. The ask here is that we are asking both senators and representatives to offset the high cost of caregiving by co-sponsoring the Bipartisan Credit for Caring Act. Again, it's been introduced in both the House and Senate and is awaiting committee action. There are a ton of bipartisan co-sponsors on this bill. On the House side, it's been referred to Ways and Means Committee, and on the Senate side, it's been referred to Senate Finance. Thank you, and I hope your bosses can support these great bills.
Wonderful. Thanks so much, Shannon.